They have an excellent customer service staff, best that I've seen of any product, in anything. I've read accounts of people that actually take these machines on cruises because you take this part, the cycler, and they send your dialysis bags and the supplies you need to the cruise ship. So when you get there, your supplies make it there before you do.
Oh my gosh.
So, yeah.
And you know, I have to say for us here, it was perfect because I had been in touch with Dan Palmer from NxStage, and he was so helpful. And the demo machine was here, you know, a couple days ago, and so we knew in fact that it was here. And just as you say, you need it, it's there before you get there. So this is perfect. Okay, so tell me, what is a day like for you? How do you fit this into your normal day?
Well, Liz, as I told you, I still work full time. For the time being, I'm looking to probably shave off a couple of hours from that. But I go to work, I come home, and I start the priming process with the saline going through the machine. And while that's doing that, I can get in the shower, and when I come back, I can finish to set up the machine, and then I do the other things necessary to get on the machine, the weighing of myself, taking my temperature.
Now, why do you take your temperature?
Well, to make sure you don't have anything going on, any infections. I was recently, I had something to happen where my temperature went up, and I contacted the nurse, and she told me don't run. She called Dr. Khairullah. And, you know, it's just for your safety to have your temperature taken.
And that happened right away. I mean, that was like,
yes.
Sweet. So then you finish setting it up, and this actually came to us in a box with 2 pieces, and there actually would be like an IV pole for that part if you hold up that end of it that spikes the bag, you said?
Spike will go up here, about right there.
All right, all these lines, what's the deal with all these lines?
Okay.
You can explain that to
This
us.
is your arterial line. It goes,
okay, the bright red.
Yes, the bright red, and this is your venous line. And this is the waistline here, which is yellow.
Okay.
And they all go on the priming spike. And after the machine finished priming, you detach these, and they would go to the, this is the side that goes in your arm.
Okay,
And you hook when you cannulate yourself, or I do myself.
Right.
And you hook these up to the needle, and then once you get everything hooked up, you the heparin, you have that in your system. You put that in to prevent clotting.
Oh, okay. All right. So heparin in there to prevent clotting. You wait
about 5 minutes.
It's some kind of diluted heparin.
No, it's heparin. You put it and you use it yourself. You do it and you wait about 5 minutes before you hook up.
Right.
And then you hit this green button up here. After that, well, you'll put in your numbers first, how much fluid you're going to take off. I typically take off roughly, the machine gives you about 0.2 liters during the priming, or after the priming, after to rinse back, about 0.3 liters, so it's about 0.5 liters. You put in the amount of fluid that you're going to take off. I take off about 2, which is really like 1.5 liters.
Okay.
And your settings here, the blood flow rate, how much fluid you're going to take off, and the dialysis rate. And once you know, it's real simple. The training took about 4 weeks for me, and
my gosh.
I was up and going when I get home.
This is really, you know, it's impressive, and again, the freedom that has given you.
Yes.
And I have to say, because this is probably one of the times I really, you caught me so unawares that I still laugh when I think about it, that the original machines, when I worked at Children's in dialysis, our machines were Maytag, type Maytag GE washing machines. And you know, like the inner basket, that, look at you.
Wow.
Yeah, wow, is right. That was the dialysis. Somebody had taken this and converted like the kidney into the mini basket filter. It was brilliant, but that was an enormous machine. And this is, just hearing you explain this, is crazy. It's so cool.
I'd add, I've seen patients come out of the dialysis clinics, and they're typically a little wobbly, perhaps in wheelchairs. After my treatments, I've gone for walks, I've gone shopping, you know, and done things, you know, go outside and play, you know, play with my son, things of that nature. So it's not as draining because it's a shorter treatment, it's a more frequent treatment. Right. And, you know, if you can eat more of a, if you can have a less restricted diet, naturally you're going to feel better. So all those things come into play. when you're on home dialysis, and you can't, unless I told somebody I was on dialysis, they would never know.
No, when I walked in and saw you in the green room, I thought you looked just like a good friend of mine, T. Smith, and I thought you look like an athlete. You don't look like you are, and that is one of the things that you said, that you would not ever know the patients who are able to do this, because as you even say, coming off the machine, you feel great. You don't feel run down, wobbly, nauseated, or whatever that we have seen sometimes.
No, not at all. You can pretty much, I mean, I wouldn't go into, trying to climb a mountain or anything, but you can take a nice walk, you can do things that you would, that you otherwise on regular dialysis you wouldn't. There's no way you'd be able to pull off. You have to have people, I think, from the, when you're in center, they have to come drive you home. I mean, you can do what you want after you get off of.
Now, how long have you been doing this?
Since August 2009, so it's been about 7-8 months now. That's
Khairullah. Truly.
Are you impressed?
Yeah, I am really impressed, and I mean, I love the kidneys. I love what the kidneys do. This is a phenomenal kidney. This is, and to see how well you're doing, because he told me, but to see you really to tell the story. You make it sound easy, and I know there is training and with the things you're thinking of, and it's all physics when you're setting it up to do it. But it's something you took on, and I like the fact that you decided this is what you're going to do, and you let them know. That was freedom of choice for you.
Whenever you're faced with a situation like that in life, it's best to go in aware of what you're dealing with. When I first found out that my kidneys were failing, it was, it's a funny disease. There's no high blood pressure or diabetes involved in it. They just up and said, okay, I quit, pretty much is what the kidneys do with this disease. And I started researching to see what would be the best possible outcome, which would lead me to live a more normal life than, and to perhaps, maybe I may not always be able to work full time, but to, go out and work and do some normal things as a bridge to getting a transplant. That's, I'm trying to, that's what it's all about, trying to live a more full life instead of just being wiped out all the time, not feeling good, and even not looking good. That's and it's funny when I go in the center. Sometimes even some of the patients they look at me and it's like, that's a dialysis patient. And when I was recently in the hospital, I was in the dialysis room, which I've never been in before, never had to do in center, and it's like the whole staff stopped and watched me stick the needle in my arms, and I'm sticking it in, and I'm looking, and I look up, and it's like they're looking at me like, what is he doing?
What is he doing? Yeah.
And they were, it was like it was a weird feeling, but it was funny.
And so they let you go ahead and continue to do your own. You just told them, I'm doing it myself. This is the way I do it, and and kudos to you.